It's now my pleasure to introduce Dr. Michael Tolentino. He is not only our medical director and our scientific co-founder. We wouldn't be where we are today without him. He's a retina specialist at the Center for Retina and Macular Disease in Winter Haven. He is the scientific co-founder and medical director of the Macular Degeneration Association. And as I said earlier, his dedication to patient education is the motivating factor behind his tireless commitment to participate in these events. He has an extraordinarily distinguished background, both academically and his clinical trials are used worldwide. It's now my pleasure to introduce Dr. Michael Tolentino.
Thank you, Larry. The one thing is that I was sort of, I was born into this. Really, it was genetic. My dad is, I was talking to one of my friends, and I think it was Larry who asked one of my friends, going, well, so who's more famous in the eye field, the Dr. Felipe Tolentino or Dr. Michael Tolentino? And my friend, you know, a good friend of mine, I'm the godfather to her son, goes, of course his father. I really, I won the gene pool, and my dad's here, and I just wanted to acknowledge him in the sense that he actually imbued the passion for trying to solve the problems of blindness. The way he did it was because I never saw him when I was a kid. In essence, his group developed all the surgeries to treat and reverse blindness and diabetic retinopathy back in the 70s. So in 1 week, he would do 40 cases in the OR. At that time, those cases were like a half an hour, 3 hours. So his students, his trainees, saw more of him than I did when I was a kid. Okay? And I would see him on a Sunday morning. Right before we'd go to church. He'd wake me up really early because he's a surgeon. And he would go this, Mike, when you grow up, you're going to cure blindness and you're going to cure cancer. I said, oh, thanks, that's a lot of pressure, Dad. I mean, seriously. So what that did, though, was it inspired me to actually address those two topics. In particular, first, when I worked in high school in his laboratory, and we helped develop a substance that we would use to repair retinal detachments called silicone oil. You still use that, right? Well, I was working on that when I was, I think, 17, okay? And then I worked at the NIH, National Eye Institute, when I was in college, while trying to develop a medicine to resolve cataracts. And then I finally moved on to trying to develop a cure for both diabetic retinopathy and macular degeneration. Now, we haven't developed a cure, but we have furthered the understanding of macular degeneration and diabetic retinopathy, and now I'm going to, in the afternoon, I'm going to share with you some of the works that we have done to really alleviate blindness in patients who are suffering from these conditions. Now, what I'm going to start out with is showing you the importance of macular degeneration. This is, by the way, the Macular Degeneration Association. That's good. I'm going to start out with explaining to you how I perceive macular degeneration. Now, when I present this, I want it to be understandable to my 13-year-old, okay? My 13-year-old is pretty smart, so how about my 7-year-old, okay? So I'm going to explain to you, and this is not meant to be condescending, but just in a way to explain it to you so you can understand it. The way a basic scientist like myself can understand it. When somebody tells you, or I tell a patient, you have dry macular degeneration, the only thing I'm telling them is that they have these yellow spots inside their eye. Okay? That's the picture on this side. Okay? If you have very advanced dry macular degeneration, then what happens is that you develop this sort of appearance called geographic atrophy, which is really just corrosion. Now, what are these yellow spots? Well, the reason I have a picture of an old Caprice Classic here, because that was my first car. Okay? And my first car was like this rust bucket. those yellow spots just represent rust. You know what rust is, right? Who here in the room doesn't know what rust is? My 7-year-old knows what rust is. But imagine you can actually define your disease by a natural process that occurs in nature. We are truly rusting away. That's why I have white hair. That's why my skin isn't as smooth as my 7-year-old's. He asked me this, okay? It's because we're rusting away. Rust, another word for rust is called oxidation. And oxidation is really why nothing lasts forever. And I'll explain to you what that whole process is. But as long as you understand that that's what you have, that your eyes are rusting away, then you can understand that we can't cure that. We can slow it down, and that's what I'm going to try to show you today. But we can sort of slow it down so that it won't matter, because we will have advanced long enough and preserve our vision for a long enough period of time. So the game really is to preserve or prevent the rusting from corroding so that you can see for the rest of your life. Okay? Now, I'm not going to go over the symptoms because Dr. Dupree went over that, but let me go over to something called wet macular degeneration. Now, wet macular degeneration really is as Dr. Dupree mentioned, it's something called choroidal neovascularization. Now, what's interesting is that what this represents is when blood vessels grow into the rust. Now, for some reason, the rust seems to attract these blood vessels. And that is actually my claim to fame. My dad helped develop all the surgeries, but I worked on the understanding of why blood vessels grow into the rust. And I'll explain that to you in my talk in the afternoon, well, why that happens. So, why is wet worse? Well, having macular degeneration is bad overall. But wet is worse mainly because it's faster. It takes away your vision. It can take away your vision overnight. And it's the way I explain it actually is that the blood vessels, when they're first starting out, they end up looking like a blister. Okay, and Dr. Dupree showed you that blister, remember, in his pictures with the OCT?
My doctor's approved.
Well, if you have a blister on your hand or on your foot, it's not going to be that important. I mean, it's going to be annoying, it hurts, right? But imagine having that blister inside the center of your vision. That's not good. And that's why you lose vision from wet macular degeneration, because you have a blister. Now, if you start out with a blister, which is a fluid blister, you can still see through that. So the only thing it's going to do to your vision is distort it. Now, distortion is just as annoying as anything else, right? And that's why when we pick up macular degeneration, we want to catch it when it's just a fluid blister. And that's why we have all these technologies that Dr. Dupree mentioned to try to pick that up as early as possible, right? Why? Because what you want to prevent is the development of a blood blister. A blood blister is bad. You can't see through blood. So I have patients who literally wake up and all of a sudden they open their eye and I have a big spot in my vision. Well, that's because they have developed the blood blister. Okay? Now, what's the problem with blood? Well, all of us have had cuts, right? What happens when we get a cut? Well, we get a scar. Correct? A scar is bad if it's inside the center of your vision, because you know what? I have a scar from my appendectomy, and I can still see it. Now, it's on my stomach here, so it's not that important, but if it was in the center of my vision, guess what? That's going to be permanent. We can't reverse that. If we can't reverse a scar here in my stomach lining, then there's no way we can reverse a scar inside the eye. And this is what a scar looks like inside the eye. Okay? Now, I have a lot of patients who developed macular degeneration, wet macular degeneration, before we had the treatments that we'll be talking about in the afternoon. And they come in and they ask me, you know, I've had an aspiration for 10 years, can you do anything for me? If I see this, I go, I'm sorry, it's kind of too late. But if we catch it at this stage, then we have a lot of things we can do for you. We can literally prevent you from going blind with all the treatments that we have. So that's why it's so important to identify this disease very, very early and treat it very, very early. Now, again, this is just to give you a visual of how I perceive this. I like to garden. I have a really nice garden, and I try to take good care of it. But I don't raise roses. I usually have things more like annuals and then patients. But it's the same concept. As a gardener, you know what I do? I do the same thing that I do as an eye doctor. I want to preserve my garden. And the only thing I can do to preserve it is to try to get rid of these weeds, right? And in Florida, I grew up in Boston, so our weed season and our growing season was only in the summertime. Here in Florida, my God, you can never get past it. I mean, I just looked at my garden yesterday and I said, well, if I wasn't doing this, you know what I'd be doing? I'd be tilling the soil over in my garden. You know what I mean? Because there's all these weeds that were growing. And, you know, I had just done this 3 months ago, and it's all come back again. This is the same exact problem that we face as eye doctors. Mainly because we have to try to get rid of this weed and keep it away. And I'm going to explain to you how we can do that in the afternoon. Now, the symptoms we're seeing of wet maturation, Dr. Dupuy discussed, so I'm not going to go over that. The next step is, why is this such an important disease? And I'm going to explain to you, it's because of the epidemic that's going to happen in the near future. Now, this slide is titled epidemiology, but it actually could be termed epidemic. Why? Well, because maturation is the leading cause of visual loss and impairment in patients over the age of 65. It's called age-related macular degeneration for a reason, because we get it as we age. We get older. And it makes sense because, you know, rusting, my dad, we rebuilt my grandfather's car. It's a 1923 Buick, okay? And when we first got that car, it was a rust bucket. It was all rusty. So we had to rebuild it and do all these kind of things, etc. But any car, any person that has lived long enough is going to have a lot of rust, okay? And that is the reason why we call this age. I know, darn, I heard that. Yeah, right, exactly. You know, that is why you know, we get this condition only after a certain age, because it takes time for rust to build up and cause its processes. Correct? Now, this is a bad slide. In essence, what we're showing here is, you know, in 2000, there are 35 million people over the age of 65. By 2030, that will have doubled to 70 million people. And then by 2050, we'll be up to almost 90 million people who are over the age of 65. So what does that mean? The disease will double. You see how that works? And that is why it's very important to sort of stop this condition, or to try to prevent it from progressing, because there are going to be a hell of a lot of people, if we don't do something about it, who are going to be succumbing to this condition. Now, this is another graph which explains to you pretty much what happens as we get older in terms of the eye disease. So, when you turn 65, right, I mean, only 5% of the population is going to have some form of macular degeneration. But when you reach the age of 85, and there are going to be a lot of people reaching the age of 85, we're living longer. Almost 1/3. So, you know, they do this at medical school. They go, look to your left, look to your right, and you know, at the end of 4 years, one of these people are not going to be with you, okay? Because they'll have dropped out. Well, that's the same thing, you know, I'm talking to a population which is already pretty much likely has or is affected by macular degeneration, but when I talk to people who are not, that's what you can tell them, you know? Look to your left, look to your right. One of these people are going to be affected severely by macular degeneration. 1 in 3. That's a very, very big problem. Okay? So, what are we working on right now? We're working on a way to prevent vision loss from macular degeneration. Yes, this is the reason why we're doing this conference, is to educate you, to say that, no, there is hope, okay? We have strategies and technologies that can help prevent anybody in this room from losing their vision or preserving their vision for a much longer period of time. I mean, I can't promise that we can do that for every single individual, but these are strategies that have been worked on for the last 20 years. I've been working on macular degeneration literally since 1991, okay? And actually before that, my dad was working on it, so, but I'm a molecular surgeon, he was a real surgeon, and we're now focused on molecular surgery. But these are the strategies that I'm going to go through, and I'm going to go over them sort of in a quick fashion. But can we prevent vision loss from macular degeneration? The answer is yes. And how to do that? First of all, we need to identify the risk. Not all of you will have problems. Some of you will have more problems than others. Can we identify that risk? Yes, we can. How do we do that? We use genetic testing. Okay? And that's what, I hope, how many people here in the room use this service for, to get genetic testing? Fantastic. Fantastic, fantastic, fantastic. I'm going to go over how we use that genetic test to help you take charge of your health care, okay? And do something about preventing visual loss from this disease based on your genetics. The next thing is we want to catch it early. Dr. Dupree mentioned this 4C home that's in the back here. I've been working with them for over 7 years, developing this technology. Actually, we're doing a clinical trial for them right now in Winter Haven, Florida. And we're providing it for patients who have very severe dry macular degeneration to hopefully monitor them at home so that if they develop the wet, they'll be caught immediately and they can be treated immediately, and that can preserve their vision. The third thing that I'm going to talk about is something called nutritional supplementation. In particular, I'm focusing on something called antioxidation. Now, we're going to be having talks about other nutritional supplements that are good for you and good for your eyes, but I'm going to focus specifically on this thing called anti-rusting. Okay? I told you that's what dry macular degeneration is all about, rusting, right? So what we've got to do is we've got to get you a good Rust-Oleum. Now, please do not spray WD-40 in your eye. Okay? That's not good. Okay? We have better rust prevention than WD-40. Now, AMD, macular degeneration, although it occurs when we get older, is a genetic disease. We have known this for over 2 decades. If your father or your mother has macular degeneration, your chances of getting it are 50%. Okay? And I always tell this to my dad. You know, I go, I always love to blame all the bad things in my life on my parents. So let's do that. The problem with this disease is that sometimes you can't even blame your parents. Imagine if your father or mother are not affected, your risk still is 12% of getting the disease. And I have lots of patients who said, you know, my parents never had it. I don't have any uncles or aunts or anything, but why do I still have this? It's because of something called genetic pooling. And of course, most of these genes come from Northern Europe, in particular, like the United Kingdom, Sweden, Norway, Switzerland. And so if you have any of that in your bloodstream, well, unfortunately, you have the genes. Especially if you're like, I grew up in Boston, so we have a lot of Irish Americans. That's an easy one. Yeah, you're at risk. You know, I just tell them flat out, you know, if you have Irish blood, you have the gene. Mainly because Ireland was an island. The United Kingdom was an island. on Ireland. So as a result, there was a lot of what we call intermarriage, and there was no expansion of the gene pool. That's the reason, okay? You know, that's why, you know, Princess Di and Prince Charles, you know, they were actually related, you know, like, you know, many. So they're keeping all the genes in. You see how that works? Now, the good thing is that we took that observation, and a good friend of mine and also a colleague of my partner, Dr. Karen Gears, a gentleman named Greg Hageman, he identified the genetic abnormalities that result in the development of macular degeneration. In particular, he identified a very important, I'll call it a gene. It's called complement factor H, okay? And those who got the genetic testing today, you're going to be tested for these gene panels to see if you have either the high risk or the low risk, okay? Now, how important is, you know, we know that we find genes all the time. You've heard, oh, there's a gene for this, a gene for that, etc. But you know what? Macular degeneration is special. And the reason it's special is because we seem to have found most of all the genes that cause this disease. And the way we know that is, first of all, if you want to know what your risk of developing macular degeneration is, if you are positive for 3 genes that I listed over in the first slide, the possession of those 3 genes can actually give you a 285 times risk of developing macular degeneration. So let's put this make this more personal. Let's say someone here has none of the genes, and someone here has all 3. That person who has all 3 will have 300 times, that's 30,000% greater chance of losing vision than the person who doesn't have the genes. That's pretty impressive, isn't it? And why do you think, you know, the Macular Degeneration Association is offering this here? Because the association between the genes and the disease is better than the association between cholesterol and heart disease. How many people here get a cholesterol test? Okay? This test is probably 4 times better than that test in predicting what it's supposed to predict. So that's why we're offering it here. Okay? The other thing is that not only is it a good predictor if you're going to develop disease, it's also a great predictor if you're going to progress. So let's say you already have the disease, and that's what we're doing the test here for. You have the dry macular degeneration. Can we predict if you are going to progress in the next 5 years? Okay? Yes, we can. And the way we do that is through a test, which we offer today. It's a test called Macular Risk. There are other companies that are doing it, but the one that we're using right now is, I would consider the most understandable and simplistic at this stage. The other tests it's very hard for me to explain the test results. I could if you were a PhD, but you know, most of my patients aren't PhD candidates. And I used to be a professor of molecular biology at the University of Pennsylvania, so I actually was a thesis advisor for several graduate students. And yes, I can explain that to them, but they don't have the disease. Most of them don't. It's a very simple test. Again, some of you got this in this room. Really, it's just you get the DNA from your cheek, and it's a very easy. You just have to swirl it around a couple times. And the most important issue is how do you interpret the results? It's very simplistic. What they did was they made it so simple that when you try to, you can actually look at the risk score that you'll get. It's going to be a 1, 2, 3, 4, or 5. If you are a risk score greater than 3, between 3 and 5, you're actually going to have a much higher risk than the general population of developing the disease. Now, what do we do about that? Well, we can stratify your risk very well, in actuality. If you have a category risk of 5, 4, or 3, you have to be seen more often and be monitored more often. Or get the 4C home monitor at home. If you're 1 or 2, it doesn't mean you're not going to get macular degeneration, but you're at the normal population risk. Okay, so you can probably be followed just normally, like once a year or once every 2 years. It's important to have this genetic risk taken for you, and you only have to do it once. In order to really identify if you're high risk, think colon cancer. You know, if you have the gene for colon cancer, you're going to get more colonoscopies. Not very pleasant, mind you. This one is just more eye exams, which is, I don't know, I think eye exam versus colonoscopy, I'm not sure. I think maybe, but who knows? Some people say the eye exam's worse, but I don't think so. Early detection means less blindness, because if we detect you early, we will be able to preserve your vision. And that's how we have all these monitors. And I'm going to talk about one of the monitors here. This is the 4C home. And I coined it the ADT for AMD. ADT is a home alarm system. And what it is that and please, I'm not going to explain this to you too much. I want you to anybody to go back to our sponsor here. I've been working with these guys for 7 years because this is the best way to monitor our patients. It's going to monitor you for compliance, and it's going to also monitor you for development of wet macular degeneration. Okay? And that's very, very critical because catching this disease early is tantamount to preserving your vision. Now, I want to go into the nutritional supplementation a little bit. I'm not going to go over it too much, but I want to share with you sort of some new findings that one of my friends in the University of Utah really discovered. And really, we want to get the best anti-rust or rust resolver that we can get that is not harmful to the eye. Like I said, WD-40 is not good. Rust-Oleum is not good for your eye. Okay? But we have something that actually is, I call it factory rust protection that sort of God gave us when we were younger. Okay? You know, when we get a new car, we have factory rust protection. Well, when we're born, we have factory rust protection inside our eye. But what ends up happening as time goes on is that rust protection wears off. Now, I just want to say rust equals oxidation. Okay? So you've all heard, and there are magazines upon magazines and people talking about antioxidation, but really, oxidation equals rust, rust equals oxidation. And you want to protect your eye with antioxidants. Now, I'm going to explain to you what an antioxidant is sort of quickly. Oxidation really is just a chemical process where you have something called an oxidant, which is like iron or in this case, the yellow spots called drusen inside our eye. And then you have something called free radicals. A free radical is just a molecule like oxygen, right, which can give an electron and destabilize the moons of usually a stable molecule. So what happens is this free radical steals an electron from this iron oxidant, and that chemical reaction results in rusting. Okay? At this very second, this very microsecond, it's happening in all of us right now because we breathe oxygen. And oxygen is actually the main sort of oxidative or free radical that we have in our environment. Okay? So yes, we are rusting at this very microsecond. This is what's happening inside all of us at this very moment. Now, what is an antioxidant? An antioxidant really is just something that neutralizes these free radicals. So it's a molecule that has a lot of these moons that can easily donate and neutralize these free radicals. Okay? So, is that understandable to most people? Most people understand that, right? I explained this to my 7-year-old and he understood it. I'm not quite sure how deep, but you know, I'm going to try to make him a molecular biologist one of these days, but we'll see. So what have we studied in the past? Well, the antioxidants that we know. Vitamin C, vitamin E, zinc oxide. Unfortunately, we have also studied a vitamin called vitamin A, which is not good. First of all, vitamin A is not an antioxidant. right? Second of all, vitamin A has been implicated in causing the progression of macular degeneration. But we studied this as part of a large government study that we were involved in. Actually, my dad's partner up in Boston was the spearhead for this. Her name was Joanna Seddon. And we studied vitamin A. So and the reason we studied it was completely political. It was really one of the government officials who was manning the study said, well, you know, my mom told me that vitamin A was good for me. You know, Bugs Bunny and all, right? So we should study that. And that's why we studied it. Unfortunately, more studies have shown that we're actually developing treatments for the corrosion caused by macular degeneration, which is to deplete you, make you vitamin A deficient, and we've shown that making you vitamin A deficient actually slows down your disease, right? So what I implore everybody in this room is to make sure to look at your vitamins that you're taking for eyes, and make sure you don't have a large amount of vitamin A. And if you are juicing like 100 carats a day and drinking that, please stop, okay? If you have macular degeneration. You can juice 1 or 2 carats, okay, but not 100. Okay, you just don't want it too much. Now, this brings me to something called carotenoids. Carotenoids are the factory rust protection that God gave us in our eyes. It actually is really the protectant that is in nature. We see it in vegetables and plants and fish, etc. And there are over 600 carotenoids. But really there are only 3 carotenoids that are found inside the eye to protect the macula from light damage and oxidative stress. Now why is that important? Well, because this macula, which is the very center of your vision, has the most blood flow in the whole human body, and therefore is the most oxygenated part of your body. If that is the case, then it is undergoing the most oxidative stress in the whole human body. And that's why we get macular degeneration. So what we need to do is we need to replace these carotenoids, these protectants, these antioxidants, as we get older, because they get worn away. Remember, the only thing that an antioxidant does is it gives away its electrons. Well, if you live long enough, you've given off a lot of electrons, right? It neutralizes these. So you've got to replace them. And you've got to keep on replacing them. And that's why we need protection. And that's what I'm going to talk about. Carotenoids, the 3 that are in the eye: lutein, zeaxanthine, and mesozeaxanthine. Now, we've known about lutein and zeaxanthine for a long time. But mesozeaxanthine has been more recently studied, and from all the research that's being done, really, this is the major player. And I'm going to show you the data for it. First of all, it does 2 things. 1, it's the most potent anti-rust molecule that gets into the eye. Second, it produces, and it actually re-increases the pigmentation that you had there when you were 17 years old. Now, light is bad for your eyes. Why? Because blue light, in particular, furthers photooxidation. So you need to replace what you had when you were younger with sort of that blue light filter. Now, can you do it with your diet? Well, for lutein and zeaxanthine, you can. You can eat a lot of spinach, collard greens, or you can take vitamin supplementation. You can do both, okay? The problem with mesozeaxanthine is unless you eat a Chinese diet. One of my postdocs is the head of retina in Beijing University, and one of her colleagues did a study showing that the Chinese diet has a lot more of this mesozeaxanthine than the American or Caucasian diet. Why? Well, because to get the mesozeaxanthine in your diet, you have to eat goji berries, the shell of fish, the innards of crab, which my mom loves, by the way. She loves the innards of blue crab. I can't stand it, but you know, I grew up in Boston. Turtle, and also the skin of fish and trout. Not the fat, but the skin. How many people here eat the skin of fish? Okay, so you guys have some good amounts of the mesozeaxanthine. really the only way you can get this is really through supplementation. And unfortunately, you know, this was a chagrin. This brand, Macular Health, they patented the process. They got locked out. So, you know, you really can't get this through any other supplementation. So that's why, although I'm not into promoting, you know, products per se, this is really the only place you can get it. Is through this thing called Macular Health. Now, I think that the iSolutions in the back, one of our sponsors, is going to provide everybody in this room who wants it a month supply of this Macular Health, which actually is a very, it's by far the best antioxidant that you can get for the eyes, period. And I say that from a scientific perspective and also a clinical perspective. But let me even explain to you more why it's so important. Remember I told you those carotenoids? There are three that get into the eye: lutein, zeaxanthine, and mesozeaxanthine. Well, mesozeaxanthine is only found in the macula. Zeaxanthine and lutein are found all in the periphery. Remember, we're dealing with macular degeneration. Macular degeneration. And so, it's obvious that God put it there for a purpose. Second, this is the study that convinced me. This was done by Paul Bernstein, who was, he was actually a student of my dad's and a good friend of mine at Harvard. He's an MD PhD from MIT, Harvard MD. And he did this study where he compared lutein, zeaxanthine, mesozeaxanthine, and the combination, and tried to scale their oxidative or antioxidative powers. What he found was very, very amazing, actually. What he said was, first, we knew that mesozeaxanthin was the best antioxidant. But if he put all three of these together, they were better than each of them individually. That's called synergy. And it's very unexpected in the basic science world. Really, this is a seminal paper. And what that told me was that there is a reason why we have mesozeaxanthin, zeaxanthin, and lutein in the center of the vision. And that's why you can't benefit from just getting one or two of these nutrients. You have to have all three of them at the same time in order to garner the highest level of antioxidation. So again, this is Macular Health, and I'm not sure when, but at the break, please go over there and get your 1 month sample. I mean, the Macular Degeneration Association is very, I mean, the science is so strong with this that we have to share it with all the people in here and educate you about, you know, what's the best thing for your eyes. Conclusion. Get genetic testing. You can do that here. Second, if you are moderate to high risk, you know, consider getting a home monitor so we can pick up the wet macular degeneration as quick as possible. And third, take your carotenoids, right? Remember, oxidation is happening at this very moment. You've got to keep on replenishing it so that you can constantly have a protective barrier to the oxidation. Okay? Thank you very much.